Lower extremity palpation video lab 10. Bones of the leg, anterior and lateral leg, dorsum of the foot. The bony features we will be covering are the tibial tubercle, the subcutaneous surface of the tibia, the medial malleolus, the medial condyle of the tibia, the lateral condyle of the tibia, head of the fibula, and the lateral malleolus. The first 5 bony features on your list have the patient sit with bended knee. Tibial tubercle. To palpate, find the patellar ligament just below the apex of the patella and go a bit more distal on the anterior proximal tibia. Keep your hand here. The subcutaneous surface of the tibia is very close by. To palpate, go medial and distal to the tibial tubercle. Once again, keep your hand here. Medial malleolus. Slide down the long subcutaneous surface of the tibia until you reach the large medial bump by the ankle. This is the medial malleolus. Medial condyle of the tibia. To palpate, the patient is still sitting. Find the tibial tubercle and go 1 finger width medial. Lateral condyle of the tibia. To palpate, again, patient is sitting. Find the tibial tubercle and go 1 finger width lateral. You are on the lateral condyle. The next 2 bony features are on the fibula, the lateral lower leg bone. Head of the fibula. To palpate, find the lateral condyle of the tibia and go just lateral and a bit distal. You hopefully feel a rather rounded knob. Keep your hand here. Lateral malleolus of the fibula. To palpate, move your hand down the lateral leg to the rather prominent lateral knob. This is the lateral malleolus. Another way to find the head of the fibula is to find the lateral malleolus first, and then move up the lateral lower leg until you reach the head of the fibula. Now to palpate and test some muscles. Tibialis anterior muscle. We will be palpating the tendon of insertion as it crosses the ankle medially. To test and make prominent, have the patient dorsiflex, toe up, heel down, their foot while inverting, sole in, that foot. The tendon should be very noticeable. Extensor hallucis longus. To palpate, you will find the tendon on the medial dorsal foot surface. To test and make more prominent, have the patient hyperextend their big toe against resistance. Next is the extensor digitorum longus. To palpate, you will locate the tendons on the dorsum of the foot for digits 2 through 5. To test, have the patient hyperextend their toes 2 through 5 against resistance. The next 2 muscles are lateral leg muscles, and we will be palpating them by the lateral malleolus. First, fibularis longus. To palpate, place fingers slightly above the lateral malleolus. To test, have the patient evert, sole out, and plantar flex, heel up, toe down, their foot. Fibularis brevis. To palpate, place your fingers slightly below the lateral malleolus. Have the patient once again evert, sole out, and plantar flex, heel up, toe down, their foot. Next will be the combined muscle bellies of the extensor digitorum brevis and the extensor hallucis brevis. To palpate, find the lateral malleolus, then drop down, and then move more medial onto a soft mass. To test, have the patient hyperextend their toes against resistance. That soft mass should become firm. Dorsal pedis artery is the last feature on Lab 10. You will be taking a pulse of this small artery. To find this artery, feel for a dorsal depression at the midpoint of the ankle joint. You are looking for a dip between the tendons of the extensor hallucis longus and the extensor digitorum longus. Wait a few seconds and the pulse should become evident. This concludes Lab 10 palpation.